Thanks for joining me today. This is Dr. Brett Bernstein. Today's brief webinar will be on the use of the Provation Multicare software program. What I'd like to do is take you through a mock patient and the fields that need to be filled out appropriately to meet documentation requirements. The first field you will see on the left is the doctor assessment. Upon clicking that, the first field you need to click is patient assessment. The following drop-down menu will appear. The first field, past medical history, including surgery, usually should be checked off as unchanged from initial consult. Following this, medications and allergies having been reviewed and unchanged, that should be answered in the affirmative. The presence or absence of lab results should be noted. In this case, we'll check off no. Baseline behavior should be noted and usually would be calm. A brief physical exam needs to be documented for all patients prior to them undergoing their procedure. In this case, we'll indicate that the heart and lung exams were within normal limits. The Multicare class should be confirmed with the anesthesiologist if one is being used. If not, you should assess the patient's oral airway yourself. An abdominal exam needs also to be done and should be indicated with the appropriate checkmark box. The ASA score for patients, again, should be confirmed and corroborated with the attending anesthesiologist, who may have filled in this field during his own documentation requirements. If not, you need to fill this in. Next field is for the consent. The sedation plan, if an anesthesiologist is present, would be indicated as MAC. If you will be giving your own sedation, this should be indicated as moderate, or if the patient is refused or you plan on doing the procedure with none, then check off none. Following this, you must depress the Save Data button. For those of you who are practicing at an ambulatory center, the next tab that needs to be completed is the Pre-Evaluation tab. As you can see, this is to indicate that you have assessed the patient and found them to be a suitable candidate for the planned procedure. That should be depressed as yes, and again, the Save Data button must be pressed. The CMS Surgical Safety Checklist is currently present at many of the ambulatory centers and will soon be implemented at all of the affiliated continuum hospitals. This surgical safety checklist is an ambulatory surgery center requirement. The template that is now being used at our centers includes the following fields. These will generally be completed by the nursing staff prior to and after the procedure. The most important fields are that the timeout has been done and that the patient has confirmed the following: their identity, the procedure, and the consent. Also, that a crash cart is available, that the pulse oximeter is on. The allergies have been confirmed. Airway and aspiration risk would generally be confirmed with an anesthesiologist if they're present during the procedure. Blood loss is usually not an issue during endoscopic procedures performed in ambulatory centers. The timeout needs to be confirmed and verified. Name, procedure. Antibiotic prophylaxis would generally only apply to cases such as varicose bleeding or peg placement. However, that field, if not relevant, needs to be filled out as NA. Antiplatelet and anticoagulation use and the amount of time that this has been discontinued for prior to a procedure should also be confirmed. Anticipated critical events for the endoscopist and anesthetist also need to be discussed prior to the procedure being performed. Following the procedure, under sign-out, The nurse again should confirm what the procedure done was, any key concerns for recovery, most importantly for biopsy specimens to confirm that these were identified and labeled. This box is crucial to check off. And again, to the endoscopist, anesthetist, and nurse, whether any key concerns for recovery and management of the patient. Following completion of these fields, the Save Data button should be depressed. After completing these fields, you must sign the note, enter your password, and then finalize. And again, it's absolutely crucial that the doctor assessment be done prior to the performance of the procedure. For those of you performing procedures at an ambulatory center, as you know, the consent forms are done prior to the procedure electronically. The hospitals at this time are currently using paper consent forms, but we hope to soon have electronic consents available. The consent forms are available electronically both in Spanish as well as English. Please click on the Procedure Consent button. Following this, you will see a PDF version of your center's consent, including risks and benefits. This should then be signed by the physician. Following the signature, this must be finalized. In this case, because there was no signature yet by the patient or witness, it's giving you an alert. Under normal circumstances, that would have been completed. Following the procedure, the medication reconciliation is crucial to complete. Again, it is crucial that this be done following the completion of the procedure and should not be done prior. The first field that you will see pop up, any additional instructions regarding medication use. Here we will say no, that needs to be saved. Following this, the Discharge Meds tab should be depressed. Select existing meds. In this case, no medications have been listed. However, under normal circumstances, a list would be available below in this box, in which case you would click those medications that you would want the patient to still remain on. Again, following that verification, you would sign the note and again finalize. Thank you for participating in this brief webinar on the successful documentation using the Provation Multicare system.